Good afternoon, everyone. Thank you so much for taking the time to join us today. We have heard a lot of interest regarding the discussion around school safety and prevention. The cross-divisional teams have been diligently working to really bring together information and provide updates regarding school safety. And so we wanted to take some time to provide you those updates and some state examples based off of the discussions that we've had over the course of the last few months. We have had, as of today, we had 31 states sign up for this webinar, so there's certainly a high level of interest. We are really excited to have all of you join us, as well as the speakers who have taken time out of their schedules today to share information. We are going to move to the next slide. I wanted to just ask a few housekeeping tips. There will be an opportunity for questions and answers at the end, and there is a way to raise your hand. However, I do want to ask that if you place yourself on mute, to just be mindful in doing so, because in some cases, when you push mute or hold on your end, it will cause music to play for everyone, which will interrupt the flow of the meeting. So we are going to move the slides. I don't know why. Move to the next slide here. So if you have questions for either myself or the speakers, you can use the chat box at any time. If you would like to mute or unmute your line, we just ask that you do so in the little box that is on the screen. There's also the method to, if you have specific questions that you don't want to post through the chat box that you'd rather ask live, you can raise your hand. So joining us, we have several members of the NGA team. There are 3 different team members, or there's 3 of us total that I'd like to introduce. My name is Aaliyah Samuel, and I am the Division Director for Education. We also have joining us Dr. Sandra Wilkness, who is a Program Director in our Health Division, and is really spearheading a lot of the work around mental and behavioral supports across the Health Division. So she's joining us as well. And then we also have Jeff Locke, who is the Program Director for the Homeland Security and Public Safety Division. He has really been helping to lead and guide us through not only the state site visits, but also a lot of the partnership work across the division and ensuring that we are all moving in the same direction. So a very special thank you to my colleagues in both the Health and the Homeland Security and Public Safety Division. Without their diligence and support, this work would certainly not be occurring. So thank you to our NGA partners. So today we have just a couple of pieces that we really want to hone in on. One, we have had an opportunity to host one cross-divisional school safety site visit, and we have 2 others on the horizon. However, there's been a lot of work that has been occurring in the states, and there's 3 specific state examples that we would like to elevate with you today. We have members from the West Virginia and Maryland teams joining us, and then I will be providing a quick update on some of the school safety work that's occurring in Nevada. In addition, we recognize that with this cross-divisional work, there are certainly different perspectives on how to frame the discussion around school safety and prevention. And so we have some phenomenal speakers that will be joining us, that will be sharing a perspective on education, a perspective on health, and then also a perspective on Homeland Security and public safety, all addressing school safety. And then we'll have an opportunity for some questions and answers. So we have 3 key objectives that our teams would like to share with you today. One, talk about both recent state initiatives on school safety, provide briefings from subject matter experts on different aspects of the school safety work that is occurring, and then also offer an opportunity for state-to-state discussion. During this time window, the NGA teams will be taking copious notes to ensure that as we follow up with states, if there are any specific requests or questions, we are able to follow up appropriately. So now we will move to, without further ado, before we get into the state examples, I do want to turn it over to Jeff Locke, Program Director for Homeland Security and Public Safety. His division has been doing a lot of work around this issue, and I just wanted to provide an opportunity for Jeff to make any comments or remarks or brief update.
Thanks, Aaliyah. Hi, everyone. Thanks for joining us this afternoon. As Aaliyah noted, I'm with the Homeland Security and Public Safety Division, where we've been tasked with helping bring together a cross-divisional partnership with both Aaliyah's Education Division as well as Sandra's Education Division, or excuse me, Health Division, and all state in an effort to give an in-state workshop series in Maryland, West Virginia, and Massachusetts, where the focus really is on a multidisciplinary strategic planning approach between similar sectors. So really mirroring the approach that you all are taking in the states between public health, education, and public safety and homeland security. So just a note to say thanks for those in attendance from the public safety and homeland security communities. We look forward to the discussion. I just want to also to note to my colleague Sandra, if you have anything else to add for the health division colleagues, just wanted to give the floor to you at this time as well. All right, with that, we'll turn it back over to Aaliyah.
Great. So now we will move into the state examples and state site visits. We are very fortunate to have two members from different states join us today to share the work that's occurring in their states, and then I will share some of the work that's occurring in Nevada. We had the opportunity to have Brian Mitchell from Governor Sandoval's office join us at our meeting in Little Rock last week, and we have an opportunity to really sit down and get a much better understanding of the work, and I look forward to sharing that. So without further ado, I'd like to turn it over to Tony Domingo from West Virginia. We are actually heading out as a cross-divisional team to West Virginia on Wednesday to kick off the work. So Tony, the floor is all yours.
Thank you very much. Regarding recent initiatives here in West Virginia, again, I'm with Homeland Security and Emergency Management, but at the end of February, 1st of March, I was moved to our Fusion and Intelligence Center. So I've been working with the Fusion and Intelligence Center to find a way that we can better share information and push that information out to school safety directors, school principals, and or the school county superintendents. Again, that's still a work in progress. Part of that has been we're trying to educate the educators about how to handle some of the sensitivity regarding the information that we need to push out to them. So the Fusion Center director has had several meetings with the West Virginia Division, West Virginia Department of Education, and likewise, I've had several meetings as been a representative of Homeland Security. I've had meetings with members of the West Virginia Department of Education. We had made some inroads with them in February and March once I was moved over here. Those contacts, however, left our state agency and took other jobs in other areas. So we're back to rebuilding those bridges with the Department of Education and trying to move things forward. Our approach with them has been basically that we want to have a meeting with you regarding one school safety issue, but then when we're there, we always push the collaboration for all stakeholders and everyone needing to know. Then we got involved with the opportunity to have this NGA-sponsored school safety conference coming up in 2 days. And that's been, I think, a big help for us to get stakeholders involved. I've had several meetings at the West Virginia Department of Education with two of their new hires. One's their counselor and one is a person over leadership, but they're probably going to be doing a lot of the safety stuff in the next couple of months until the Department of Education gets reorganized. But again, getting together to plan the conference we're having in a day and a half. And it started out as an overall conference on safety. But we realized very early on that a lot of the problems, not just in West Virginia schools, but appears a lot of problems throughout the nation, kind of boil down to mental health issues. So the conference, our workshop in a day and a half, has basically turned a lot toward mental health. And attendees there, we've got 7 or 8 attendees from Homeland Security, myself, my director. We have people from the Central Office or Department of Education in Charleston that deal with the mental health aspect, nursing aspect, counselors. And we've reached out a lot throughout the state to try and get representatives from the principals for a high school, a principal for the middle school, principal for elementary school, counselors from high school and middle school, superintendents, safety directors, local and county and state law enforcement, and then we have fusion liaison officers throughout the state, and we're trying to get some of those involved. So again, trying to get all the stakeholders involved at this workshop coming up, and to get them to meet each other and talk. And again, underlying issue being trying to get collaboration going, get all the stakeholders to realize that it's probably time to start looking at multidisciplinary teams or threat assessment teams to deal with the threats our schools are having, and to share their information. If something goes to one law enforcement agency, it needs to be shared with the other law enforcement agencies in that area and school officials. And likewise, trying to get school officials to understand they need to share information. If they have a gun threat, they need to let 911 know and Office of Emergency Services know, while law enforcement has been contacted also, but so that all the people know what's going on in that school in case something happens, you have a lot of people hurt or injured. So collaboration is a big thing we're trying to push. All this is going on while we're also still trying to update and manage our Safe Schools database that we've had for several years, and trying to get the school personnel to understand how important it is to have their school contact information up to date floor plans and crisis response plans. And that's briefly what's going on here.
All right, thank you so much, Tony. We look forward to coming out and meeting with you and the West Virginia team this week. I would now like to turn it over to Cara Sullivan and Kathy Shirk from Governor Hogan's office in Maryland to share a little bit of the work that's happening in Maryland around school safety. So I will turn it over to, I believe, Kathy.
Yes, thank you. Good afternoon, everyone. My name is Kathy Shirk, and I'm joined here with Cara Sullivan. After the shooting in Parkland earlier this year, Governor Hogan really realized that more needed to be done to keep our students safe, to keep our schools safe. And so immediately following that tragedy, we worked to consult key stakeholders, including our Maryland Center for School Safety, local school systems, local superintendents, law enforcement, and other stakeholders to identify areas of improvement needed in Maryland. And we built off the work of the Maryland Center for School Safety. And after the conversations we had with all of our other stakeholders, Governor Hogan introduced a comprehensive bill on school safety earlier this legislative session.
Great, thanks so much, Kathy. So the legislation that was passed in Maryland was the Maryland Safe to Learn Act of 2018, excuse me. In the aftermath of Parkland and Great Mills, we really addressed the physical, behavioral health, and school climate and culture needs as well. A few of the components of the bill that I'll highlight really briefly, and we're happy to follow up with additional details or the text of the bill. The legislation greatly expanded our Maryland Center for School Safety. So Maryland has had a Center for School Safety for about 5 years. The legislation greatly expanded its scope as well as its budget and staff size. And we created aggressive statewide safety standards to annually conduct safety evaluations and update their safety plans. We required statewide standards for the training of school resource officers. So we know that a school resource officer's needs in terms of training and expertise is different than your average law enforcement officer out in the community. We also multidisciplinary behavioral threat assessment team, having collaborators from across disciplines at the and decide how best to intervene with students who may be experiencing it. And then finally, the legislation. And we're working with school systems to ensure that they have the resources to be able to meet these requirements. And those requirements include leverage existing mental health resources for students, developing an annual schedule of drills, identifying a school safety coordinator to be certified by the center, and then reporting to the Center for School Safety any data regarding lockdowns, threats, or events at the school. And so in addition to passing the Safe to Learn Act, the Maryland General Assembly and Governor Hogan also included in the fiscal 19 budget approximately $40 million to improve school safety. And the vast majority of this funding will be made available to local school systems to help them implement the legislation's requirements. So the legislation passed in April of this year. What we're able to do is engage with NGA to do a day-long technical assistance workshop for our school safety stakeholders here in Maryland to really work through the timeline of implementation and kind of the NGA for coming out here and helping us start to think about that as we begin to implement this bill. So with that, I know that was a really high-level overview, but Aaliyah, we'll turn it back over to you. Happy to take any questions. Cassie and my contact information is available on the screen, and we're happy to chat with anyone and everyone about our experience here in Maryland, and would be happy to learn as well. So thanks, Aaliyah.
Thank you so much. I will say there was quite a bit of appreciation by the governor's education advisors who were able to hear a little bit more about the work that was happening in Maryland last week. So thank you very much for being willing to not only share the legislation and the work that you have going on, but also lessons learned as you continue this journey. So I would like to take a moment and share with you the work that's happening in Nevada. And in Nevada, it is an interesting, there's interesting dynamics because, as many of you may or may not know, Governor Sandoval is an exiting governor. So he is not running for re-election, and this is his transition year. And one of the things that Governor Sandoval wanted to do is create, a successful transition plan around school safety, and to make sure there was a process in place for the next governor, and that the next governor would not have to come in and really begin the school safety work from scratch, so to speak. And so part of the work that's happening through Governor Sandoval's School Safety Task Force is that there is a committee that's looking at two core buckets to create recommendations for Governor Sandoval. Those recommendations are around some core areas, really wanting to address not only the building and facility safety, but also addressing the school climate and culture within the school as well. And so part of the recommendations that are being discussed through the School Safety Task Force can really fall into three different priority areas. One, looking at what can be completed through executive order through the governor's offices. Two, what policy recommendations could be taken to the incoming governor. And three, what those budget recommendations would be. And so as Governor Sandoval's School Safety Task Force continues to work through the recommendations, they are certainly looking at state examples. They have called in national experts and partners, including our partners at Wested, so that they can have best practices and recommendations to both address the physical infrastructure of the schools, but then also the school infrastructure as well. And so those are really the two core buckets that the recommendations will be surrounded. They are in the process now. They've had a series of meetings, and we are looking forward to hearing what the recommendations are as they move forward. I would like to share a little recap. Just last week, we had our Governor's Education Advisor Policy Institute in Little Rock, and we had 23 states and 1 territory represented there. And we had an opportunity to have almost an hour-long discussion on school safety. And during this panel and discussion, we had, as you look at the photo going from left to right, we had Dr. Bob Runcie, who is the superintendent of Broward Common Douglas tragedy occurred in Parkland, Florida. And he had an opportunity to really talk to us about some of the implications of the policies that were made at the state level as they move into implementation and recommendations that he would have based off his experiences. And one of the things I think that came out loud and clear in Dr. Runcie's remarks was the need for collaboration and really wanting to look at what those best practices are on both the state and national level that can be implemented at the local level. Then we have Sharon Hoover, who you'll be hearing from a little later, who was able to share a lot of resources around behavioral and mental support. Then we had Brian Mitchell, who is from Governor Sandoval's office, who shared with us the recommendations and the work that's happening under Governor Sandoval's School Safety Task Force. Then we had an opportunity to hear from 2 Homeland Security advisors. The first advisor was Kevin Klein, who is the Homeland Security and Public Safety Advisor to Governor Hickenlooper in Colorado. And he really helped us think more comprehensively around school safety, dating us back from Columbine and lessons learned from Columbine till now to Parkland, including the importance of their anonymous app or tip line that really allows students to be able to share without any concern of being revealed any tips that they might have, but also how their support line or app has been able to triage other needs that the students may have. Then we heard from Perry Plummer, who is the Homeland Security and Public Safety Advisor for Governor Sununu in New Hampshire, and he was able to outline the report that they completed in really short order. And the report has a whole host of recommendations, but they really honed in on 17 recommendations. And of the recommendations, they decided to really focus their energy and efforts on addressing school climate and culture as the #1 intervention, and really looking at social emotional learning as a common thread or approach. We'll hear a little bit more about social emotional learning from 2 of our panelists a little later. And then we had Cara, who joined us from Maryland. Thank you so much for making that journey, Cara. We appreciate it. All right, so now what I'd like to do before I turn it over to the next speaker is to give Sandra Wilness provide a few updates as to the work that the Health Division is.
And Aaliyah, thank you for circling back to me. One of whom I've learned a ton from already. Her name is Sharon Hoover, between Cushel, which is fantastic. And the only thing that I would like to add is that we in the Health Division are excited for this cross-division work at NGA, here to support you. And one of the things that we're focusing on most on the health side is behavioral health and social support systems, which is my area of expertise. And we stand ready to bring the experts to your state or help you out through technical assistance over the phone and so on, as we've done with the handful of states you've heard from already today and in other sessions. So thanks, Aaliyah, and let us know how we can help.
Thank you, Sandra. So it is with great pleasure and honor that I'd like to introduce our next speaker to you. Our next speaker is Scarlett Lewis, who lost her son, Jesse Lewis, in the Sandy Hook tragedy in December of 2012. And since losing her son, Scarlett has been a phenomenal advocate for social emotional learning and supporting students. Scarlett is a member of the Federal School Safety Commission, and she has been sharing her expertise across the nation. One of the requests we have heard from governors' offices is really wanting to get a better understanding of the role of social emotional learning in school safety. And we've heard it loud and clear from the Homeland Security side with Perry Plummer talking about how they have integrated social emotional learning across their entire state. And now we'll have an opportunity to hear from Scarlett directly a little bit more about her Choose Love movement, social emotional learning, and some of the phenomenal results and data that they have collected or are collecting. So without further ado, I would like to introduce Scarlett. Scarlett?
Thank you so much. And thanks for the honor of speaking today, everyone, and your interest in school safety. I am the mom of Jesse Lewis, who died at Sandy Hook Elementary School alongside 19 of his classmates and 6 educators in one of the worst mass murders in U.S. history. Since that day, 5.5 years ago, I realized that I would have to be part of the solution, and also realizing that Adam Lanza, who was a former student of Sandy Hook Elementary School, whose mother also taught at the school, lacked the fundamental skills, tools, and attitudes that are provided by social emotional learning. And when I say that, I mean the ability to have meaningful connection with others, the ability to have positive relationships, skills and tools for resilience, the ability to manage his emotions and resolve conflict, just to name a few. These skills and tools are not innate, interestingly enough. They must be taught. And if they aren't taught, we don't necessarily have them. So I realized quickly that my job was more than just to reduce and prevent violence in schools. We have a whole host of other epidemics going on in our schools that then translate into our society, including mental illness, bullying, loneliness, substance abuse, suicide, trauma, and including violence. Actually, just to give you a statistic, twice as many students have murdered students in their classrooms this year than military have died in active combat. So anyway, I was actually heartened to find that there is a solution to actually that entire list of issues, one of them at least, and this social emotional learning actually has decades of research showing that it proactively prevents all of those issues, including violence, by giving kids the skills and tools that they need to not only get along in life, but what employers need most, are looking for most, you need in relationships. Founded the Jesse Lewis Choose Love movement with the mission of making sure that every child has access to what we know is in their best interest, which is social and emotional learning. The current programming that's in schools is, as far as anti-bullying, the DARE program for substance abuse, which we know is ineffective and we continue to do, and some other programming we know simply aren't overall statistically effective. However, we know social emotional learning is. In fact, I've worked with Nevada and I've worked closely with New Hampshire. We know that actually social emotional learning is the #1 way to have a safe school. And usually when I say that, people are shocked because they think, what? What about what we normally think of for school safety, which is external safety measures? That's door locks, active shooter protocols, single point entries, arming, not arming school resource officers, bulletproof glass. But in actuality, although very important, none of that addresses the cause of why a child wants to enter a school and harm themselves or another child. The only thing that does that is emotional learning. So in other words, social emotional learning is cultivating safety from the inside out. There cannot be a comprehensive school safety plan without social and emotional learning. I worked with Governor Sununu and Terry Plummer directly in their statewide school safety plan that has been released. They have actually movement coordinator to make sure that every school, not specifically what we offer, which by the way is a free, comprehensive K through 12th grade social emotional learning program that includes all of what's been being taught in classrooms today, including mindfulness and positive psychology, neuroscience, and more, but just to ensure that schools have a social emotional learning program and that it's being reality. Actually, a report, I'll wrap up with this. There was a report that came out. That report is available online, and that commission worked for 2 years, was given unprecedented access to everything Sandy Hook, Adam Lanza's personal files. They did interviews, education records, mental health records, school records. It was one of the most extensive reports released, really focusing on the shooter himself. And they came up with 3 things that could be done to prevent another Sandy Hook shooting or a similar school shooting. And one was gun safety, and this is in no particular order. 2 is more access to mental health, and 3 is social emotional learning. In fact, the report implores all schools to implement a comprehensive year-long social and emotional learning program that is taught, this is very important, with fidelity. And so that is what I talk about a lot with our program. We just wanted to offer a program for just to make sure that every school had access. We know we're not in competition with any other program, but if a school doesn't have a program and they're interested and perhaps they can't afford one of the ones that are out there, we want to make our resource available.
Thank you so much, Scarlett. Well, our team member, Tiffany, will actually follow up with you to get a copy of the report as well as the one-pager that overviews the Choose Love movement so that we can share with all the policy advisors on the call today.
Absolutely, thanks.
And I would now like to turn it over to Dr. Sharon Hoover from the University of Maryland, who's doing a lot of work nationwide around mental and behavioral supports in schools. Dr. Hoover presented with us, and she was with us in Little Rock and really did a phenomenal job. So without further ado, Sharon?
Great, thank you, Dr. Samuel. I hope you can hear me okay. I first of all just want to thank Scarlett Lewis, who just spoke before me, and I can't think of a better segue into the topic of comprehensive school mental health. And I have not had the pleasure of hearing Scarlett Lewis speak before, but certainly the ideas and strategies that you discussed, Scarlett, are right in line with the work that we've been doing as a National Center for School Mental Health for the past 2 decades. And you can go to the next slide. Just a few things that I wanted to kind of put on folks' radar. First, when we talk about comprehensive school mental health as a strategy within school safety, I just want to emphasize, and I think Scarlett did a nice job of setting this up, that school mental health goes beyond just thinking about addressing and identifying young people with mental health challenges, but we really need to be thinking from a public health perspective, mental health promotion. And we think it's probably one of the best resources for accessing information about social emotional learning is CASEL, the Collaborative for Academic, Social, and Emotional Learning at casel.org. And this is the wheel that reflects the competencies within most social emotional learning programs. You can go to the next slide. And then, of course, within the discussion of comprehensive school mental health, I think you may need to keep clicking to show some of the other figures on here. You can just keep clicking away, but the idea here is just that schools really are an important place to identify and address young people who may be experiencing or who are at risk for mental health challenges. We know that most mental illness begins early, by about the mid-teens to mid-20s, and that severe disorders and challenges are often preceded by less severe disorders that go undetected. And so we just want to make sure that when we're thinking about comprehensive school mental health, that we're thinking universal to more targeted and select approaches to addressing this in schools. We can go to the next slide. So there are many reasons why addressing mental health in schools is really critical. And these are listed here. Again, we know that we have greater access to all youth in a school building to do activities like social emotional learning and mental health promotion. We cannot wait until young people start experiencing mental health challenges and referring them to community mental health centers. We also know that most young people with mental health challenges do not make it to community mental health even when referred. The no-show rates are incredibly high, but they also tend not to be able to follow through with services. So we need to be putting services and supports where young people are. There's a host of other reasons why addressing mental health in schools is critical, not the least of which is the last thing indicated here, which is the great potential to impact the learning environment and educational outcomes. And there's a wealth of literature documenting the impact of mental health supports on educational outcomes. And we'll move on to the next slide. So one of our colleagues, Dr. Ron Astor, when speaking at a congressional briefing immediately after the shooting in Parkland, Florida, talked about two visions of schools. And I think it's important that we keep this in mind in the context of our school safety efforts. One vision he talked about being a vision that believes the path for lasting safety comes from welcoming, caring, and supportive schools. And an alternative vision of school safety is really based more on restrictive and punitive reactions to mass shootings in schools that aims to protect students from mass shootings, but is often based on tools and ideas that originate in law enforcement, prison architecture, and military strategies. And while some of these may be important, what we know, and what Scarlett alluded to, is that we have decades of large-scale epidemiological studies that show that schools with positive school climate and integrated social emotional learning really have significantly reduced all of the negative target outcomes that we are trying to address with some of these other school safety measures. So I'll move on to the next slide. And we're often asked kind of what does this look like in terms of a comprehensive school mental health system? We want to emphasize that schools should not do this alone, that it needs to be done in partnership with community mental health providers and other providers and partners in the community, as well as with students and families. This is but one illustration of how this might look in a school building or school district, with school and district employees carrying most of the weight of universal mental health promotion and social emotional learning activities, and community partners really augmenting existing efforts with more clinical interventions. And I want to emphasize that these types of what are often called tier 3 clinical interventions for young people with identified mental health problems, it's really critical that we offer them on site in the school building, again, because we know most young people are not making it to community mental health settings. So I'll move on. I have a couple of slides that just illustrate some of the approaches that schools and districts are taking to tier 1, tier 2, and tier 3 services. We can go to the next slide. Some of the universal approaches include things like healthy school building architecture, and there's a lot of discussion around how to harden our schools, but there's also some good work, for example, coming out of Harvard School of Public Health about trauma-sensitive school architecture. There's a number of approaches at the universal level that we want to pay attention to. This slide that's up now is on tier 2 strategies. So this might include things like threat assessment, mental health screening, but also how do we provide support for students who are transitioning in and out of schools, in and out of more intensive psychiatric placements? How do we identify students who may just need additional check-in support during the day? And how do we implement interventions for students with mild impairment? And there are a couple of examples of evidence-based interventions here for that. The next slide just illustrates some of the tier 3 strategies that many schools and districts are using, and this includes on-site evidence-based treatments for young people with mental health challenges, as well as partnerships where we do refer for evaluation in school or community services. We'll go on to the next slide. One of the things our National Center is often asked about is how can schools or districts understand what's happening in their building or in their district, and how can states understand that? One of the things that we've been charged with over the last couple of years is to develop an online system that schools and districts and states can access at no cost to go in and map their services. You can go to the next slide. We developed the SHAPE system. It's the School Health Assessment and Performance Evaluation System. To date, we have hundreds of schools and districts who have gone in and mapped their tiered services and supports, including things like social emotional learning, as well as Tier 3 treatment services. They can map their supports and services. They can get pre-customizable reports that show their implementation quality and sustainability, as well as a host of resources to help them engage in quality improvement around school mental health. The next slide just illustrates some other strategies that states have been using to really kind of cull the resources that they have within their states. There's so much happening within regions, within states that is illustrative of the high quality school mental health work that's happening, but sometimes it's hard to put it all in one place. And so we've seen many online hubs at the state level within departments of education and or behavioral health that illustrate and give resources for school mental health. Many states are now hosting annual school mental health conferences. We host a national conference, but it's really great to see states having their own state mapping report. So Maryland, for example, the legislature mandated a report 3 years ago to get a better idea of what was happening in terms of community partnerships with schools. And those are just a few of the illustrations. So I want to thank you for inviting me today, and happy to share more information after the webinar.
Thank you, Sharon. And just to the states, we are going to send out the PowerPoint of slides that will include the report from New Hampshire that both Scarlett and I also mentioned from Perry Plummer, as well as Scarlett Lewis's Choose Love. She has a one-pager and a report, and the report that she was referencing. We'll make sure that we have that, as well as the SHAPE login that Dr. Sharon Hoover just mentioned. I now would like to turn it over to Dr. Lina Alathari, who is from the United States Secret Service, who will be providing us an update.
Good afternoon, all. Thank you for having me. It's really great to see that a lot of the states are enacting some of these recommendations that really look at a comprehensive approach to school safety. I will be brief. I just want to talk to you a little bit about what our center does, the National Threat Assessment Center at the Secret Service, and what resources we offer for federal, state, locals, public safety, as well as school personnel. If you look at the first slide, and by the way, I just need to caveat that I can't see the webinar and I can't see the slide because the Secret Service is so secret that they block everything. So if you do have questions, please let someone else know because I won't be able to see the screen. But just to talk to you about the center, so we actually have a congressional authorization for our mission. We were established in 2000 to conduct research training, consultation, information sharing on prevention. So we are authorized to study all types of targeted violence, translate our research operationally, and then do training for stakeholders on preventing these types of attacks. All of the reports that we released are publicly available on the website because that's the mission that we have. So if you look at some of the reports, just to give you an idea of what we offer, the first report all the way on the left side is we call it the yellow guide. That really set the standard for how to establish threat assessment investigations. It was based on research that the agency had conducted in the late 1990s looking at those who might attack public officials and public figures. Since then, we've conducted a variety of other research projects. One of the biggest ones we have ongoing is examining targeted attacks against government at all levels, including federal, state, local, and the targeting of law enforcement. One of those reports was already released, and it looked at attacks against federal government. We've also just recently released, in March of this year, a report looking at mass attacks in public spaces that have occurred in the year 2017. We plan on doing this, unfortunately, because we know they'll probably keep occurring on an annual basis, because we really want to understand why these things occur, what are some of the motives, what are the behaviors that might help law enforcement and others in terms of prevention, specifically for school safety, and that's what I'll focus on for the next few minutes. After Columbine tragedy, the director of the Secret Service approached the Department of Education and offered a partnership to study this phenomenon of school shooters, because we had just released a study looking at would-be assassins and those that carried out attacks. That is the premise for the Safe School Initiative. Most of you are probably familiar with it. That study set the standard for establishing threat assessment programs in schools, and the accompanying guide provides a framework to do so. One of the most significant findings that we saw based on the Safe School Initiative, which looked at attacks against K-12 schools, is that in 81% of the incidents, other kids knew about the attackers' intentions, whether directly or they heard it through others. And that was a pretty significant finding, because we wanted to know if all of these other kids knew, why did they not report it? And that's why we did a follow-up study. That's the report that you can see on the screen and the bottom row in the middle. We call it the bystander study. We actually interviewed those bystanders from the original study that did not report the information. And we also interviewed students that had come forward with information, and attacks were averted. And one of the significant things that we found, and this is why it contributes so much now to the literature on establishing safe school climates, is that the climate and the culture of a school was one of the #1 reasons why bystanders did or did not come forward, whether they had a trusting adult relationship, whether they felt that the school had processes in place that would listen to their concerns without judgment. Following the Virginia Tech attack, we collaborated once again with the Department of Education and the FBI, this time looking at campus attacks. This year specifically, if you go to the next slide, we released a guide on school safety. And I have to say, this is all about prevention. So this is trying to identify students who might be experiencing distress or engaging in concerning behavior way before they would even think of violence as an option. So threat assessment is just one part of a comprehensive school safety effort, which includes emergency planning and other activities, tabletops, active shooter drills, and all of that. But what I'm specifically talking about, and the training that my agency provides, is on prevention and setting up threat assessment programs. So this guide was in response to Parkland tragedy. Our director wanted us to redouble our efforts to assist the community in terms of school safety. So we released this guide, which is an actionable step-by-step plan for how schools can set up violence prevention plans, whether at the school level or at the district level. It's written in a very practical format, so that's easy to follow, and it offers a lot of resources. A lot of the things that the other panelists had mentioned already, we actually support as recommendations. The social and emotional learning, training for all stakeholders, including not only school personnel and law enforcement, who are often the school resource officers, but also for parents and for kids on how to identify behaviors that are concerning and what they can do to report it. One of the things that we're doing now is, in response to the Federal Commission on School Safety, is not only did we release the guide, but we're actually in the middle of conducting a new study looking at school attacks. We're going back since 2008, so we're looking at incidents between 2008 and 2017. Right now, we've identified about 42 incidents that meet a very specific criteria of occurrence or a recently former student who's carried out an attack against a K-12 school. We're hoping that that study will be released in the summer next year. But if you go to the next slide, most of our research is what feeds into why we make the recommendations that we do. We know from our research, the past research and the new incidents that we're looking at, that in a majority of cases, and this is not just in terms of student attackers, this is also people who conduct other types of target attacks in the community, that in a majority of the cases, these perpetrators had elicited concerns in others around them, whether it was for a blatant threat or engaging in violence, aggressive rhetoric, but also in more subtle forms of behavior, self-harm, cutting, in the form of cutting, being bullied or being a bullier, making suicidal thoughts, talking about committing suicide, just even sudden or dramatic changes in behavior, decline in performance, and such behavior. So the most important thing that I'd like to leave you with, and I'm not going to read the slide, it's available to you, this is just overviews of what the guide covers, is the early identification and intervention into students who might be experiencing distress is the number one aspect to prevention. If we can intervene early, and we're not talking about intervening with legal actions or even intervening in punitive actions, because we're talking about identifying students in distress early on. And we caution that even if you have to take disciplinary actions, to do so in a way where you're still connected with the student, where they still feel like they're being supportive, and that the school is working very closely with the parents. So I'll close it off here, just to let you know that my center and at the agency has been doing training for 20 years. We've trained over 125,000 law enforcement as well as school personnel. That training is free of charge. We usually send it out if you need a training, whether it's to prevent mass attacks in the community or a specific training focused on K through 12 or campus violence, then to go through your local service field office. Thank you.
So I do recognize that we are at time. We are happy to, as the NGA team, stay on the line if there are any questions. I wanted to put up all of our contact information. You'll see there myself, Dr. Sandra Wilkness, and Jeff Locke from Homeland Security. Our plan is to send out all of these resources and information along with the recorded link for the webinar so that you can have access to it. I will say that all of our speakers have been so gracious to offer their support as well and their contact information. So if you would like to contact any member of the NGA team and or a speaker with additional questions or material requests, please feel free to do so. But our team will be working diligently to send all this information out. At this time, we don't have any questions in the chat box, but I don't want to close out without just at least waiting a moment or two to see if there are questions. Okay, thank you so much for joining us. Please look forward to more updates from the teams regarding our work around school safety. This is the beginning of much of our work and the continuation for some of the other divisions. So more to follow. Thank you all for joining us today and have a wonderful afternoon.